These benefits are designed to keep your healthcare costs low and your coverage complete. You continue to have an HMO plan option with 3 benefit levels, the PPO with either the traditional plan or the qualified high deductible plan with a health savings account, the PPO plan paired with the Blue Select Plus network, which is a qualified high deductible plan with a health savings account, the KCMO Custom Plan, which is an EPO plan that will give you access to St. Luke's providers as well as Blue Select Plus network providers to help you lower your total healthcare costs. And new this year, you can choose the Spira Care plan. Spira is an innovative EPO plan design developed by Blue KC. As a Spira Care member, you'll enjoy comprehensive primary care at convenient care center locations, as well as benefits of the Blue Select Plus network. Let's start with a few basics. Some of your plans have a deductible. A deductible is the amount you must pay for a service before Blue KC begins to pay. Deductibles run on a calendar year, January 1st to December 31st. Deductibles reset on each January 1st. If the plan has a deductible, it is an embedded deductible. If you are enrolled as an employee plus 1 or more dependents, you are subject to the family deductible. With an embedded deductible, no one family member pays more than the individual deductible amount. Examples of services that may be subject to a deductible are listed on the screen. Some of your plans have coinsurance. Coinsurance is the shared expense you pay after you have met your deductible. If a service is subject to coinsurance, a percentage is paid by you as the member and a percentage is paid by Blue KC. Any cost you pay in coinsurance will help satisfy your out-of-pocket maximum. Some of your plans have an out-of-pocket maximum. This maximum represents the most a member will pay for in-network services in a calendar year. Deductibles, coinsurance, and on some plans, copays for medical services and prescription drugs, these all count towards your out-of-pocket maximum. Once this maximum is satisfied, all of your in-network costs for medical services are covered at 100%. Let's look at the specifics of each plan in detail. The first plan options for the 2019 open enrollment are on the HMO, and you will have 3 benefit levels to choose from: a base, mid-level, or premium plan. With an HMO, you must choose a primary care physician in the Blue Care network. You can also self-refer to specialists. The main difference between HMOs and PPOs is that there is no out-of-network coverage on the HMO. You must receive care from an in-network provider to be covered. Unless you're experiencing a true emergency, care received from out-of-network providers will not be covered. Also, HMO plans provide coverage exclusively in the Kansas City metro area. If you are traveling outside the metro area, you will have coverage for emergencies only. Here is a side-by-side comparison of the 3 HMO plan options. HMOs are copay-driven plans. You will pay a copay according to the type of service you are receiving. Your prescription drugs also have copays based on a 3-tiered system. HMOs do not have deductibles, coinsurance, or out-of-pocket maximums. With the exception of the inpatient-outpatient hospital copays that are limited to 5 days per year per member, your copays on the HMO plans will continue indefinitely as services are incurred. Here is a side-by-side comparison of the hospitals in each network in the Kansas City area. A yes indicates the hospital is considered in-network for the plan. A no indicates the hospital is out of network. For the first 3 plans, the highlighted column shows the hospitals that are considered in-network. Review this list to understand the hospitals that are considered in-network or out-of-network. Before choosing an HMO plan, make sure your specific primary care doctors, specialists, chiropractors, or durable medical equipment providers are in network. Go to bluekc.com, click Find a Doctor, then choose Blue Care under Medical Networks to complete your search. Your next plan options for the 2019 open enrollment are on the PPO and are paired with the Preferred Care Blue network. You can choose either the traditional PPO plan or the PPO Qualified High Deductible Health Plan with the Health Savings Account. A PPO gives you access to providers who have contracted with Blue KC and have agreed to accept our negotiated discounts. On this PPO, you have in and out of network coverage as well as national and international coverage. While you do have coverage for out of network services, we encourage you to use in-network preferred Care Blue providers whenever possible. In-network providers offer the deepest discounts for their services, resulting in lower out-of-pocket costs for you. If you choose one of these PPO plans, you do not need to select a primary care physician, and you can self-refer to other specialists or providers in the network. Here is a side-by-side comparison of the plans, and both utilize the Preferred Care Blue network. Your traditional plan has copays when you visit the doctor, urgent care, and for prescription drugs. When you need major medical services, such as high-tech scans or inpatient/outpatient care, your deductible must be met first before Blue KC starts paying a portion of these charges. Your deductible is your first dollar responsibility. For major medical services, once your deductible has been met, Blue KC begins paying 80% of the in-network charges, and you will be responsible for 20%. This is your coinsurance. If you have a year on the traditional plan where your major medical services reach $2,500 individually, Blue KC will then pay your in-network major medical expenses at 100%. $2,500 is your out-of-pocket maximum for major medical individually on this traditional plan. Please note, even if you meet your out-of-pocket maximum in a calendar year, you will continue to pay copays at the doctor or for prescription drugs on this traditional plan. Next, the Blue Saver Premium Plan on the right-hand side is a qualified high-deductible health plan with a health savings account. On this plan, you will pay first dollar for any medical or prescription drug charges until your deductible is met. There are no copays on this plan. Once you have met your deductible on this plan, in combination with your medical and prescription drug expenses, Blue KC will cover the rest of your in-network expenses at 100% for the calendar year. There is no coinsurance or separate out-of-pocket maximum on the Blue Saver Premium Plan. On both of these plans, Blue KC covers your routine preventative care at 100%. The highlighted column shows the hospitals that are considered in-network for these plans. Review this list to understand the hospitals that are considered in-network or out-of-network. Before choosing one of these plans, make sure all your medical providers are in-network. Go to BlueKC.com, click Find a Doctor, then choose Preferred Care Blue under Medical Networks to complete your search. Your next plan option for 2019 open enrollment is also a PPO, but it is paired with the Blue Select Plus network. This plan, also known as the Blue Saver Base Plan, is a PPO qualified high deductible health plan with a health savings account. This PPO gives you access to providers who have contracted with Blue KC and have agreed to accept our negotiated discounts. You will have in and out of network coverage as well as national and international coverage. While you do have coverage for out-of-network services, we encourage you to use in-network Blue Select Plus providers whenever possible. Employees who live in the Kansas City metro area can benefit from the network savings when seeking care from a Blue Select Plus hospital or provider. Those who reside outside the 5 metropolitan area counties are eligible to enroll, but must visit a Blue Select Plus hospital or provider for benefits to be paid at the in-network level. In addition, if you choose this PPO plan, you do not need to select a primary care physician, and you can self-refer to other specialists or providers in the network. This plan is paired with the Blue Select Plus network, and you will have in and out of network coverage. This high-performance network includes the 9 top metro area hospitals listed here that are considered in-network. Providers and hospitals in this Blue Select Plus network have agreed to greater discounts, which means a cost savings to you. This network covers the 5-county metropolitan area only. This includes Jackson, Clay, and Platte counties in Missouri and Johnson and Wyandotte counties in Kansas. In addition to the 9 top hospitals shown on the screen, The Blue Select Plus network includes more than 3,600 doctors and specialists. This network is also available on the City of KCMO Custom Plan and the new Spira plan, which we will discuss later in the presentation. Using the map on the screen to understand your network coverage, refer to number 1. With this plan, these 5 counties include Blue Select Plus providers and hospitals that are considered in-network. Next, refer to number 2 on the map. If you receive care in these counties shaded in white, which are outside the Blue Select Plus network and within the 32-county Blue KC service area, your care is considered out-of-network and higher out-of-pocket costs will apply. Last, refer to number 3 on the map. When receiving care outside the 32-county Blue KC service area across the nation, you will have access to the Blue Card PPO network. If you are traveling or on vacation, you will have peace of mind as approximately 96% of U.S. hospitals and 95% of U.S. physicians participate in the Blue Card network. Should you choose to use a non-Blue Card provider, you will not have out-of-network coverage except for emergency services. Here is a high-level overview of the benefits for this plan. Because this plan is a qualified high-deductible health plan, you must pay for all costs associated with your medical and prescription drug needs until your deductible is met. Once you have met your deductible, Blue KC will cover all your in-network medical and prescription drug costs at 100%. There is no coinsurance or separate out-of-pocket maximum on this plan for in-network benefits. The in-network benefits are exactly the same on this base plan as they are on the Blue Saver Premium plan. However, this base plan uses the Blue Select Plus network. Please note, as in all our plans, your routine preventative care is covered at 100% by Blue KC. The highlighted column shows the hospitals that are considered in-network for this plan. Review this list to understand the hospitals that are considered in-network or out-of-network. Before choosing this plan, make sure all your medical providers are in-network. Go to bluekc.com, click Find a Doctor, then choose Blue Select Plus under Medical Networks to complete your search. Your next plan option for 2019 open enrollment is the KCMO Custom Plan, introduced last year and was created exclusively for City of Kansas City, Missouri employees. The plan includes a high-quality custom network of top hospitals and physicians and is considered an EPO, or Exclusive Provider Organization. That means if you choose this plan, you will have in-network coverage only. Care from out-of-network providers will not be covered unless you experience a true emergency. The KCMO Custom Plan can help you lower your total healthcare cost if you seek care from the physicians and hospitals within the custom network. With this option, you have access to providers in 2 network levels. Level 1 includes St. Luke's hospitals and providers, and Level 2 includes hospitals and providers in the Blue Select Plus network that we just reviewed. Employees who reside outside the 5 metropolitan area counties are eligible to enroll, but must visit a Level 1 or Level 2 hospital or provider for benefits to be paid at the in-network level. If you choose the Custom Plan option, you will have the freedom to use any provider in the network. This means you do not have to select a primary care physician or get referrals to see a specialist. As mentioned, the KCMO Custom Plan includes 2 network levels. Level 1, also called the Employer Designated Network, provides the richest benefits and gives you access to St. Luke's providers, plus the St. Luke's hospitals marked in green on the map. Level 2 is the Blue Select Plus network, and it provides expanded access to more than 3,600 providers in the 5-county Kansas City metro area, including the hospitals marked in blue on the map. Both network levels are included in the custom plan. Using the map on the screen to understand your network coverage, refer to number 1. With this plan, the 5 counties shaded blue are considered in-network and provide you access to Level 1 St. Luke's providers, plus expanded access to the Blue Select Plus network. All other hospitals and their providers in this area that are not participating Level 1 or Level 2 providers are considered out-of-network. That means you will not have coverage from those hospitals and providers except for emergency services and you will be responsible for 100% of the costs. Next, refer to number 2 on the map. With this EPO plan type, if you receive care in the counties shaded white, which are outside the network and within the 32-county Blue KC service area, your care is considered out of network and you will be responsible for 100% of the cost except for emergency services. Last, refer to number 3 on the map. When receiving care outside the 32-county Blue KC service area across the nation, such as when you are traveling or on vacation, you will have access to the National Blue Card PPO network. Here is a high-level overview of your custom plan benefits. Similar to the HMO plans, this is a copay-driven plan. You will pay a copay depending on the service you are receiving. There is no deductible or coinsurance on this custom plan. All services are satisfied by the designated copay. The custom plan, unlike the HMO, does have an out-of-pocket maximum. This is your peace of mind number for the calendar year. It is not a deductible. Blue KC will pay all your services at 100% once your out-of-pocket maximum has been met. All copays, whether for medical or prescription drugs, go towards your out-of-pocket maximum. The out-of-pocket maximum is not an amount you must satisfy first. It is there for your protection should you have a year with very high medical expenses. Review the highlighted list to understand the hospitals that are considered in-network or out-of-network on the custom plan, plus which hospitals are considered Level 1 or Level 2. Before you choose the KCMO custom plan, make sure your specific primary care doctors, specialists, chiropractors, and durable medical equipment providers are in network by following these steps created specifically for the City of Kansas City, Missouri employees. Refer to the 2 sets of directions on the screen to access listings of Level 1 and Level 2 providers. It's important to remember that the KCMO custom plan is an EPO plan, so you will not have out-of-network benefits except for emergency services. If you live in or around Kansas City, we encourage you to consider this option to help you lower your total healthcare costs. Specialists, family doctors, pediatricians, and more are included in this network. When you travel outside the Kansas City metropolitan area, you will have access to our national and international network, Blue Card. Blue Card providers are considered in-network on your custom plan. Last but not least, we are excited to bring you the last plan option for 2019 open enrollment, which is the new Spira Care plan. Spira is an innovative EPO offering developed by Blue KC and designed by our members from start to finish. The Spira plan offers access to comprehensive, personal primary care at convenient care centers for no additional cost to the member. For any needs outside the care center, you will have access to the Blue Select Plus network. Employees who live in the Kansas City metro area can benefit from the network savings when seeking care from a Spira Care center or Blue Select Plus hospital or provider. Those who reside outside the 5 metropolitan area counties are eligible to enroll but must visit a Blue Select Plus hospital or provider for benefits to be paid at the in-network level. If you choose this EPO plan, you will have in-network coverage only. Care from out-of-network providers will not be covered unless you experience a true emergency. Just like the previous plan option, the Spira Care EPO offers members access to national and international coverage through our Blue Card network. You will have the peace of mind that your healthcare coverage travels with you. In addition, this plan does not require the selection of a primary care physician, and you can self-refer to specialists in the network. Let's take a look at what the Spira plan has to offer. Spira Care provides comprehensive, integrated care with no deductibles, no copays, and no additional cost for any procedures a member receives at the care centers. Spira Care members have access to comprehensive services at the care center, including routine preventative care visits, adult and pediatric primary care, chronic condition management, digital x-rays, and lab draws. At the care centers, integrated primary care means we are pairing medical and behavioral health services. We have partnered with New Directions to staff behavioral health clinicians on site at each clinic to assist with brief and focused interventions to care for the whole person. While the Care Center is not a full-service pharmacy, many of the top generic prescriptions are available at the Care Center at your regular copay. If your doctor prescribes one of these medications during your appointment, you can pick up the prescription before you leave. The Care Centers also offer evening and Saturday morning hours for your convenience. Hours vary by location. SpiraCare members also have access to a team of care guides dedicated to simplifying your health journey. Care guides will help members coordinate care both in and out of the Care Center. If a member needs services outside the center, the Care Guide will assist with referrals and appointments with a Blue Select Plus network provider. Care guides can also assist with records transmission, treatment cost estimates, and will explain and answer any benefit questions. Their goal is to make sure the member does not have any unanswered questions. There are 5 convenient Care Center locations in the Kansas City metropolitan area as shown on the screen. Later in 2019, a 6th Care Center location will be opening in Wyandotte County near the Legends Outlet Mall. SpiraCare members can be seen at any of the Care Center locations. However, you must choose the SpiraCare plan in order to have access to the Care Centers. For hours of operation, addresses, and to meet the care team, visit spiracare.com. SpiraCare is for members looking to simplify and personalize their healthcare experience. If you and your family's health needs in the next year will largely fall within primary care, including labs, x-rays, and routine behavioral health services, you can enjoy the peace of mind that comes from choosing SpiraCare, where you'll have the support of a care team and assistance with any services needed outside the Care Center and in your plan's network. While the plan is ideal for members who utilize the Care Centers, members still have access to their plan's EPO Blue Select Plus network. Please remember, the SpiraCare plan is an EPO plan, so you will not have out-of-network benefits except for emergency services. This means services must be received in the Kansas City area from the SpiraCare Center or a Blue Select Plus provider or hospital. Outside our 32-county Kansas City service area, services must be received from Blue Card providers. Non-emergency services received out-of-network will not be covered. Review the highlighted list to understand the hospitals that are considered in-network or out-of-network for this plan. In addition, you also have access to the SpiraCare centers. Remember, like the custom plan, your Spira plan is an EPO. If you choose the Spira plan, any hospital care in the Kansas City area must be done in one of these hospitals. Unless it is a true emergency, care in any other Kansas City hospital will not be covered. The benefit details for the new SpiraCare plan are shown here. There are no additional costs associated with any services received at the Care Center. When you receive care with medical providers outside the Care Center in the Blue Select Plus network, you will pay the discounted retail price for those services until the deductible is met. Prescription drugs for Tier 1 and Tier 2 medications are subject to a copay. A member pays the discounted retail price for all Tier 3 medications. Copays and costs associated with prescription drugs help satisfy the deductible. There are no additional coinsurance or out-of-pocket maximums on the Spira plan. All in-network services and prescription medications are covered at 100% after the deductible has been satisfied. Using the map on the screen to understand your network coverage, refer to number 1. These 5 counties include Blue Select Plus providers and hospitals, plus the SpiraCare centers that are considered in-network. Next, refer to number 2 on the map. With this EPO plan type, if you receive care in these counties shaded white, which are outside the network and within the 32-county Blue KC service area, your care is considered out-of-network, and you will be responsible for 100% of the cost, except for emergency services. Last, refer to number 3 on the map. When receiving care outside the 32-county Blue KC service area across the nation, such as when you are traveling or on vacation, you will have access to the National Blue Card PPO network. With the EPO plan type, if you receive care outside the Blue Select Plus network within the 32-county Blue KC service area, You will be responsible for 100% of the costs. Emergency services are always covered in network. When receiving care outside the 32 county Blue KC service area, SpiraCare members have access to the Blue Card network. If you are traveling or on vacation, you will have peace of mind as approximately 96% of U.S. hospitals and 95% of U.S. physicians participate in the Blue Card network. Should you use a non-Blue Card provider, you do not have out-of-network coverage except for emergency services. For more information about Spira, please join us for an open house. Open houses are our opportunity to show you around the care center and answer any questions you may have. A complete list of times and locations for our upcoming open houses is included in your benefits packet. If you would like to take a virtual tour or need additional information, please visit spiracare.com. To summarize, take a moment to review the benefit details for each plan option. The benefits shown here are in-network. Let's look at a few claim examples. In each of these examples, a description of the members and their annual medical needs are given. Each plan is then compared with the specific cost of the medical care and prescription drugs received. The premiums for each plan are annualized in the first row, and the total expenses for each plan are shown in the last row. In example 1, with an individual employee with high medical costs, you can see the Spira plan would have the lowest out-of-pocket cost for the year. The $500 traditional PPO would have the highest cost for this individual. Example 2 shows an employee with family coverage. Like many families, one individual in the family has significant costs with a hospital stay and medications, while the rest of the family are low utilizers of the plan. In this example, the Blue Saver plan with the Blue Select Plus network has the lowest cost, and the $500 traditional PPO again has the highest costs. In example 3, we have employee plus one coverage. Again, one person has significant use while the other has moderate use. In their situation, the Blue Select Plus HSA plan has the lowest out-of-pocket expense to the employee for the year, with the traditional PPO with the Preferred Care Blue network having the highest cost. Finally, in example 4, this healthy employee with coverage just for themselves actually saves money at the end of the year if they choose one of the Blue Saver plans with the health savings account. The Spira or custom plans would only have a moderate cost. These examples demonstrate that every person's situation is different. It is important to look at your individual circumstances and the circumstances of any enrolled family members when making a decision. It is also important to take into account the annual premium of each plan as you make a decision. If you need assistance in making a decision, please plan to attend one of the enrollment meetings. The full list of meeting locations and times can be found in your benefits packet. If you are changing plans at open enrollment, it is important to know how you will be impacted if you incurred expenses from January 1, 2019 through April 30, 2019. Take a moment to review how this may impact you. Please note on all plans, any applicable deductibles or out-of-pocket maximums reset each January 1. In closing, here are some important points to know. If you remain on your current plan, you will continue to use the same Blue KC member ID card. If you enroll in a new plan, you will receive a new card. If you enroll in the new SpiraCare plan, you will receive a new card that will indicate you are a SpiraCare member. Your dedicated customer service phone number is available to answer your benefit plan option questions. That number is listed on the screen. Check if your providers are in-network by following the specific steps mentioned in this video, especially if you might choose the new SpiraCare plan. Plan to attend an open enrollment meeting. Refer to your benefits packet for detailed information on the dates and times.